Las Vegas. This is Zandra Pollard with It's Where I Am. Today, my guests are Dr. David Jennis
Yes.
and Dr. Michelle
Giddings-White.
Giddings-White. I'm happy to have them here today so that we can discuss what's going on in our community. David is a clinical director from Southern Hills Pavilion Hospital, and Dr. Giddings-White is the CEO of Psychiatric Minds.
Peaceful Mind Psychiatric Services.
Thank you, Peaceful Minds Psychiatric Services. So let's start with Dr. Also everyone, please call in. You can call in for questions with these doctors. David can answer anything under the sun that relates to mental health, so let him have it. I'm going to have my questions with my relationship. I'm going to ask you a few things because I need a little help in that department too with this damn pandemic. So anyhow, let's start with where you work, what you do.
Absolutely. Well, thank you so much, Zandra, for inviting me to take part in this conversation. I am currently the clinical director at Southern Hills Hospital and Medical Center. And at Southern Hills, we have an 80-bed inpatient psychiatric hospital, and we're community providers. So on behalf of Southern Hills Hospital and myself, I just want to thank you for inviting us to participate this morning in this conversation and really just to be a resource to our community members.
Thank you for being here, David. Thank you so much. Dr. Giddings?
Good morning, Las Vegas. And Zandra, thanks for having me here so we could raise awareness about mental health. I am, as Zandra said, the CEO of Peaceful Mind Psychiatric Service. I'm also one of the providers of Peaceful Mind Psychiatric Services, and we are located on 112 South Jones Boulevard. We serve individuals across the lifespan. We do psychiatric assessments, we do diagnosis and medication management, and we make referrals based on individual needs, and we encourage people to reach out for mental health. As we go through this program, we'll talk about some of the symptoms associated with mental health issues, and we'll tell you when you should reach out for help. And Zandra, I'll turn it back over to you.
Oh yeah, okay, so Dr. Giddings is a pro. She has studied, she's ready for your questions. Do not hesitate to call in. The phone number is 702-647-3688. We just want to let you know that we are practicing social distancing in the room. So very important. I'm a big hugger and I miss hugging so much.
Absolutely.
Oh my gosh, and I just feel like sometimes with family members, I feel like I'm being rude or disrespectful. But I always have to preface and say, social distancing, just putting that little reminder out there that we're all just trying to be safe. So I want to thank my guests, and I also want to thank Donald Marquez of Your Insurance Connection, who has partially sponsored this show today. I want to thank you for providing space, or the space, for us to get our information across over the airways since the station is not open for us at this time. So I want to thank, again, Donald Marquez, Your Insurance Connection. He's located at 2300 West Sahara Avenue, Suite 800, Las Vegas, Nevada. His phone number is 702-221-1943. And you can reach him at www.donaldmarquez.com. He is Your Insurance Connection, insurance agent, and he also has a radio show talk show, as you may know, on 88.1 every Tuesday and every other Friday of the month. So, back to mental health and wellness. That's what this radio show is about, this program. And just making sure that I want to provide information that can be helpful to the community because it is so very important. And I know Dr. Giddings was mentioning before we were on air about the disparities in the community and also being accountable for our actions. So can you continue on with that for our listeners?
Well, Sandra, a part of what we were talking about was mental health care disparities in the African American community and in minority communities as a whole, because as we know, the research has shown, this is not biased information, this is statistical research that shows that there are disparities when it comes to minorities in the way we access care, in the way we're treated when we access care. And it creates a barrier for people going into care. And mental health care isn't any different. We need to seek care, but we don't because of those barriers. So I encourage people to come forward, reach out when you feel there's something wrong. There are people and places in the community that are willing and able to give you the kind of care you deserve. So I like to tell people that. With coronavirus being prevalent right now, we are already under stress. I mean, we were already in a stressful environment prior to COVID-19 coming on.
Right.
So COVID-19 for many communities, many people just provided an additional layer of stress on top of what we were already feeling.
Right.
And sometimes it takes that little feather to break the camel's back, like we say, we say that phrase, and it's true.
Right.
All we need is one more stress to take us over the edge. And how do we know when we're over the edge? And anxiety, some anxiety is good. We live with anxiety. And I think even with coronavirus, some of the anxiety is good because it gives us that sense of worry that I don't want to get sick.
Right.
So we might follow some of the guidelines because we're a little anxious about it. But when that anxiety starts affecting your functioning, sleep, appetite, socialization, you're not getting out of bed, you're not doing the things you used to, you can't enjoy the things you used to, reach out for help.
But
Talk to
Michelle,
someone.
a lot of times in our community, we wait till it's too late. And then we end up in a place like Southern Hills Pavilion. Am I right?
Yeah, absolutely. So I like to encourage individuals to look past the stigma that is still associated with receiving or participating in mental health, behavioral health services. We're all human beings. And as Dr. Giddings-White acknowledged, that all of us experience a certain level of anxiety and a certain level of depression from time to time, and that's normal by just the nature of us being human beings. And so, though, as Dr. Giddings-White alluded to, though, it's when that level of anxiety or depression escalates and it really starts impacting our daily level of functioning, then that's a cue maybe that I need to ask for help. And so I really like to encourage individuals to not be afraid to ask for help. That's very challenging for individuals sometimes to be vulnerable, to put themselves out there and say, you know what, I'm having a difficult time right now. And I think in society, generally speaking, we don't really promote that it's okay to have challenges. It's okay not to be perfect.
Yes.
And it's okay to be human. And by nature of being human, we all have challenges that we're attempting to manage on a day-to-day basis. And even when life is going good for all of us, it's still challenging.
Yes.
Well, I know I'm not perfect. And I know since you are a doctor in LMFT, which is Licensed Marriage and Family Therapy, my husband is already getting on my nerves before the pandemic. So now that we're like stuck in the same room all the time, and we're in this small apartment, we don't have like, 4 or 5 bedroom house. And part of the reason why we have the show here today is because our calls we were supposed to do it over our phone and call in with our guests. But I know in my home, my son's gonna run over and he'd be on the show saying, I love you, Mom, and kissing on me and everything else. So I don't have that privacy. But then there's people who are dealing with loneliness, and everyone's perspective is so different, which makes it so difficult. But then we also have, for those who are doing therapy, we're doing the telehealth. And so that's kind of a wave of the future. But then we were also speaking on encouraging certain individuals to go out of the house, but they cannot do it at this time. So those are some things I want to talk about. Dr. Jennings, I want to talk about how to make married life better at home when you're stuck in this quarantine with 3 extra kids and a grandbaby. And then I want to talk to you, Michelle, I'd like for you to expound on the telehealth services that you're doing. So let's start with you.
So Zandra, I feel for you, and because I think your family system right now is experiencing what so many other families are experiencing right now in our community and throughout the United States. And just the stressors of us not being able to participate in the activities that typically would be an outlet for us to release stress and to have positive socialization with each other. That then would kind of reinforce our energy and our ability to come home and you're a wife, you're a mother, you're a grandmother, and being able to wear all those different hats. We'd probably.
Oh, I'm a teacher now.
Oh.
I'm a teacher.
And a teacher.
I'm a chef.
Don't forget.
That's right. That's right.
Go on. I'm sorry.
So yeah, amazing. I mean, you deserve a round of applause, seriously. And so do all those other parents that are at home right now, having to also assume all those different roles, and it's stressful. And so I like to remind individuals, though, that it's so imperative to participate in self-care. And now you may ask me, Zandra, well, how am I doing self-care with all these people living in my house?
Right.
But you have to really identify, though, what is it that is going to help foster within you positive social, emotional, mental well-being, so that you can continue to wear all these different hats that you do and hopefully be marginally successful in wearing all those hats and trying to execute all those roles. I'm like sweating just talking about this right now because it's a real life scenario for so many of us.
Yes.
And it is stressful. So for me, every morning when I wake up, with intention, I tell myself, I'm gonna have a positive day today.
Okay.
This is so powerful for me because I'm resetting my mental track, if
You guys
you
have a
will.
phone call when you're ready.
Okay.
Where I'm really focusing, though, on wanting to start my morning, start my day off on a positive note. And I think that is really powerful, though, with intention, though. We have to be committed that I want to try to have a good day today. I want to try to have positive interactions with those in my life today. I want to have less arguing with those people that I come across with today. And it's really putting that energy forward so that we can hopefully have a positive and successful day.
Oh, that's great. Okay, so I'm going to try it. I'm going to take a bubble bath and put some chocolate cake in there and
And a cup of tea.
a cup of tea and meditate, talk to myself in the mirror, write some positive affirmations, and come out ready to be the wonderful mother and wife that I am. And I just want to say, honey, I'm sorry, I do love you. Happy anniversary. We've been married for 7 years, together for 14.
Congratulations.
Thank you so much. And every day is a challenge, but I'm willing to work it out with you. So I love you. Happy anniversary. We'll take the phone call. Callers on the line. It's Where I Am.
The little Mike, or
Your question?
is he?
It's Where I Am radio show. Can I help you? What is your question for Dr. Giddings or Dr. Jennings?
Hi, my name is Ashley. I was calling to ask about.
Are you okay, Ashley? Ashley?
We lost her. We lost her. Go ahead.
Okay, sorry. Well, we lost you, Ashley. You can try back again. So we'll continue on with Dr. Giddings, and she's going to talk to us about the new telehealth world and how that's working with the virtual therapy.
Yeah, but the telehealth, can I just piggyback onto what Dr. Jeff
Sure,
said really
please,
quickly
please.
before? Because we talked about the stress in families, and I know we as mothers, we're carrying multiple hats. We've always been, we just added another hat as a teacher and now chef, and you know, some of us weren't chefs before. But the thing I wanted to add is the stress that we talk about as adults. Remember, we're in a household with others, and our stress is felt by others. So one thing I wanted to add is that stress is transferable. So as the leader in the house, the mother, the father,
Yes.
we have to remember that we have to contain sometimes some of our emotions when we feel it, so it doesn't transfer to our children.
Yes.
Absolutely.
Because
Yes.
they process stress differently. So we may see some behaviors coming out and not realizing that we're
Yes.
triggering those behaviors.
Right.
Yes.
So we'll get back to that further on. I want to talk about telehealth as Sandra said, because I always encourage people to reach out for help. It's what I do. It's why I started Peaceful Mind, so we could get to the people that need help and give them a quality, a different kind of care. I've worked in hospitals. I've worked in outpatient clinics. I've worked for state agencies. I've worked all over, and I've seen mental health delivered in different ways. And I had my own way of thinking when it comes to people with mental health. I like to treat people like individuals, unique,
Yes.
with their own personal strengths and
Yes.
deficiencies. Because I hate to say weaknesses, because weaknesses is such a degrading word. But reaching out doesn't mean leaving your home during this COVID crisis, because many of the insurance companies are compensating for telehealth. And at Peaceful Mind, we have had to come up to the level of COVID-19. This was a paradigm or a shift that was happening with telehealth. It kind of pushed us in. And some of us, like myself, weren't ready. Because technologically, I could tell you, it's challenging. But we have gotten better at it. And now we provide telehealth services on multiple platforms. So even if you have Skype, even if you could download Zoom, which all the students are using for Zoom, so you could tell your kid, hey, put me on Zoom, I want to talk to someone, and you could actually talk to a mental health provider if you needed to. So telehealth is the new wave. It's been around for a while.
Yeah, another call when you're ready.
Yeah, some of us weren't using that telehealth service, but I encourage you. It's for some people it's easier because they just never accessed care because they were afraid to step into a mental health clinic.
Right.
You could step in and see me virtually, and you could be guaranteed that you will get the right care that you're looking for.
So how do they reach out to you? If someone feels that they need to get services and they would like to try the telehealth, how do they do that?
And it's really easy. Everything is done from home, so you just call the office. It's 702-909-4600, and you're gonna talk to someone who's very friendly, and they'll walk you through the process right from your phone, right from your computer. You fill out all the intake information that we need to provide services to you. They'll walk you through setting up Skype or Zoom or whatever you need to make the process as simple and friendly as possible for you, because our goal is to get you care. That was always my goal, to treat my community, to provide quality care, and we're gonna find a way to get that care to you. And telehealth is the way we're doing during this COVID-19 crisis.
Awesome. Thank you. Thank you for that. We'll take the caller. Hello, caller. It's Where I Am.
I would like to thank first Dr. Michelle Giddings White because her information, and everyone did, but I want to thank her for bringing forth the information about the telehealth, because as a teacher, I think a lot of people, a lot of parents are probably trying to call in because this is the first time that they have spent all this time with their children.
Yes.
I would like to suggest, and I'm going off a little, that parents please allow their children to go online into the digital learning community. That will take some pressure off of their children. Their classrooms are set up and they can check in. Well, also I'd like to say that just as a senior African American woman, I do not think on a whole that Black people really believe in mental health. I am glad that Dr. Giddings White, she's a young, beautiful Black African American woman who will bring it someone that they can talk to, that they can really relate to. And I really did agree with the gentleman. I thank you for the affirmation. But at these times, sometimes a person that's deep with so many problems, waking up, saying the affirmation, it may be 4 or 5 people using the bathroom. You are not allowed to go in and take the bubble bath, close that door, and all of those things. So
Yes.
you will be able to, since you don't have that liberty, you, there are some things you can do with that bathroom door closed if you are disciplined for that. But if not, you can get that number and you could call Dr. Michelle Giddings White. I know her personally, someone I have called myself in a stressful time. And I think she is someone that you can call. Maybe not, I don't know if you're going to get her. I hope that you get her and she can help you work through things. She did not know I was going to say this, so this is not planned. And thank you very much.
Thank you
God
so
bless
much
everyone
for
during this
calling.
whole thing.
Thank you.
Thank you so
caller.
much. Awesome. So I'm so glad that call came in for me. That makes me feel great. And that
Tell me
people,
somebody's listening.
Yes, yes.
I want the information out there.
yes. And so if anyone is in needs therapy and feels like they need that telehealth, they can call Dr. Giddings. Now, what if someone is dealing with, when she was bringing up the children in the bathroom, right? What if it's an overload, or what if there's a severe case where someone actually becomes hospitalized because their mental health is just, their mind is just taken over, and there's nothing that can be done at home, and they end up going to the hospital. What happens then? How does it work when someone is in the hospital? How do they then get to your psychiatric hospital?
Yeah, that's a great question, Zandra, and thank you for asking it. So we're talking about a lot of different topics today that
Yes.
we're kind of bouncing
Yes.
around, so I'm just taking some notes. So if an individual feels that distressed, where potentially they may be impulsive, thinking about partaking in self-harm, and maybe feeling so isolated, distressed, overwhelmed, that potentially they're even thinking about taking their own life. That those would be key indicators that would, bells and whistles should be going off to encourage the individual to reach out for support and to ask for a mental health assessment, which would determine the level of care in which we would recommend for that individual or family to receive. It's really important that individuals know that it's okay during this time and any time during their life to reach out and to ask for help. Our last caller acknowledged that as an older African American woman, that there is a little stigma maybe associated within the African American community with wanting to reach out because of that level of stress associated with depression, anxiety, trauma. And it's okay though. It's okay because we're all human beings. It doesn't mean that, and I dislike this word so much, but I think the stigma is that people believe if they reach out for mental health or emotional support, that they're quote unquote crazy.
Yeah.
And that's not the case at all. I believe Dr. Giddings White first said this morning that we all experience a certain level of anxiety and a certain level of depression, and that's completely normal.
It's normal.
Right.
We all experience it. And so I just want to re-emphasize and emphasize that it's okay to be vulnerable, it's okay to ask for help. I mean, we could even take this conversation and talk about gender.
Yes.
How men are not socialized in our community to be vulnerable, to express their feelings and to ask for help.
Right.
So how many men in our community are undiagnosed and not receiving the care that they need because they're too afraid to ask for help because of how that may look on them as being a man. I'm not supposed to ask for help.
Right.
I'm supposed to manage my business and manage my family.
Right. And there's so many expectations on just everybody. There's expectations as the woman, there's expectations as the man, there's expectations as the child, but it's just learning to work with everything that we have and working together. Is that accurate?
4 minutes. 4 minutes.
Okay, thank you. So I did want to mention that during this quarantine that I've tried some things that are different. I tried some virtual fun. I've been participating in Fancy Friday. Miss Denisha Mingo has a virtual mental health, but for me, It's more of my happy hour cocktail time, to tell the truth. But I do enjoy it. It makes me feel good. I like to participate with a glass of wine. I get dressed up, I put on my makeup, and I go online. So if you'd like to participate, do something fun, do something different, get out of the norm, please go to our website, mhsbehavioralservices.com, and join in on Friday. I know I'll be there this Friday. I hope you join in too. So we have about 3 minutes left. We're gonna wrap it up. Any last words? Please make sure you give your information to the locations.
Yeah, so this is Dr. Giddings White. In closing, because I know we're getting ready to wrap it up, I just want to encourage you. I can, for all listening and all friends and family, because it probably won't be you, but you might know someone that could use help. And help is out there. I'm not the only agency out there, but you could definitely call our agency. Again, it's Peaceful Mind Psychiatric Services, and our number is 702-909-4600. And this is a temporary thing that we're going through with COVID-19. We've been resilient. Resilience means the ability to bounce back from something that has affected you. And I want you to know that you have the ability to bounce back, but there is help out there. There's certain things you could do. Take walks, like Dr. Jess says, wake up and practice positive attitudes, positive thinking. Definitely reach out for some help if you feel like you need it.
Yeah, I just want to thank our community and thank all the listeners who are excited and mindful about fostering positive mental health within themselves, within their families, and throughout our communities. This is a very challenging time right now that I believe if we all come together, we'll get through this together. And if you are getting to that place where you're just so distressed and you feel like you need a mental health assessment, potentially you may need to go into the hospital. Call Southern Hills Hospital and Medical Center at 702-916-5000.
Okay.
30 seconds.
Okay, and so I just want to wrap it up and give this information one more time. This Friday, Fancy Friday, virtual lounge at 7 p.m. You can register via Zoom. I will put the information on my website. Please go to my website. It's whereiam.com. This show will be posted by tomorrow, Frank. And you can see all the previous shows that we've had. Thank you for tuning in. I'll see you next month, first Wednesday of the month at 9 a.m. It's Where I Am. Thank you.